Hi, I'm DrAshima Gulia, Senior Consultant, Obstetrician and Gynecologist practicing at Cloudnine Hospital, Kailash Colony, New Delhi. So first trimester pregnancy abortion can be done by two methods. One is medical method and the other is surgical method. So first let's talk about the medical method. Medical method is where the termination is done by the use of pills called as abortifacient pills. So it is fairly safe enough, but some patients may experience complications such as heavy bleeding, severe cramping, dizziness, nausea, vomiting and prolonged bleeding and prolonged pain. While it is successful in most of the patients, some patients may have retained products of conception leading to a subsequent surgical procedure to remove those products. A few of these patients may also experience infections, uterine infections and massive hemorrhage leading to anemia and shock, uterine sepsis and septic shock. Then talking about the next method, which is surgical method, it includes two types, which is dilatation and curettage, and the other one is suction and evacuation. So how is it done? A patient who is willing for termination of pregnancy by surgical method is admitted, is given anesthesia, and under anesthesia the cervix is dilated and the products from the uterus are emptied with instruments or by the help of a suction equipment, and it should be done under ultrasound guidance so that we are sure that all the products have come out and nothing is remaining inside. This procedure is associated with potential complications such as perforation of the uterus, scarring of the uterus, post-procedure synechiae formation inside the uterus, which is called as Asherman syndrome, leading to the formation of fibrous bands inside the uterus, which may lead to complications in further conception or can lead to future miscarriages. Also, during the dilatation of cervix, sometimes there can be a permanent damage to the cervical canal, which leads to incompetent cervix and pregnancy losses in subsequent pregnancies. A long-term complication of this infection of the uterine fallopian tubes and uterus leading to pelvic infection and infertility.